It is roughly 3,300 years ago in ancient Egypt. A woman thinks she may be pregnant, but there is no pharmacy, plastic test, or phone app tracking her cycle. Instead, she is given 2 containers of grain and told to urinate on them for several days. Strange? Definitely. But the surprising part is that this method may have been more than superstition. So how did ancient women know they were pregnant? Pregnancy eventually revealed itself through a growing belly and fetal movement. The real challenge was knowing early, when a missed period, nausea, tiredness, or breast changes could also mean illness, hunger, or stress. In the ancient world, the answer could affect marriage, inheritance, work, and a woman's place inside her family. Ancient Egypt treated medicine like paperwork long before most people had paperwork. The Berlin Medical Papyrus, usually dated to around 1350 BCE, describes one of the earliest recorded pregnancy tests. A woman was told to wet barley and emmer wheat with her urine every day. If neither grain sprouted, the text said she was probably not pregnant. If the grain grew, pregnancy was considered likely. The Egyptians also claimed the first grain to sprout could reveal the baby's sex. That part was wrong, very wrong. But the pregnancy test itself was not completely foolish. A small experiment published in 1963 found that urine from pregnant women encouraged germination in many tested samples, while urine from non-pregnant women usually did not. That does not mean the ancient test was 70% accurate in real life. The study was limited, conditions were different, and seeds are not hormone tests. Still, the basic idea was impressive. Use urine, wait for a biological reaction, and observe the result. They did not know what hormones were. They had seeds, crude, slow, uncertain, yet closer to an experiment than a magical spell. For an Egyptian woman, the answer could change inheritance, household responsibilities, and social status. It could reshape her future. Ancient Greece approached the same problem with careful observation and extremely confident guessing. The Hippocratic writings, produced mainly during the 5th and 4th centuries BCC, discussed menstruation, conception, pregnancy, and birth. One aphorism suggested that when a woman stopped menstruating and developed nausea without fever, pregnancy was possible. That was a sensible clue. Then things became less reliable. Other Greek texts connected pregnancy with changes in the eyes, face, skin, and movement of fluids inside the body. Some writers even claimed a woman's appearance could reveal whether she carried a boy or a girl. Could intelligent physicians mix useful symptoms with imaginary anatomy? Yes, they could. Hippocrates became the famous name attached to this tradition, but much of the practical knowledge probably came from mothers, relatives, attendants, and midwives who watched pregnancies repeatedly. They noticed patterns: a missed cycle, sickness, fatigue, breast changes, and later movement inside the womb. Physicians wrote theories on scrolls. Experienced women compared what they saw with what had happened before. Aristotle, writing in the 4th century BCA, also discussed reproduction with the confidence of the ancient world's most unstoppable dinner guest. His detailed explanations reflected both sharp observation and the limits of his time. Greek diagnosis rarely depended on one test. It depended on a cluster of clues, some sensible and some not. The Roman world gave us one of the clearest surviving guides through Soranus of Ephesus, a Greek physician who practiced in Rome around the late 1st and early 2nd centuries C. His work Gynecology included a section on signs of conception and separated pregnancy care, miscarriage, labor, and newborn care into distinct subjects. Organized, practical, almost suspiciously modern. Soranus listed stopped menstruation, breast changes, nausea, heaviness in the body, and other sensations after intercourse. Some were useful. Others were vague enough to describe stress, poor sleep, or a bad lunch. More importantly, he valued skilled midwives. He wanted them literate, calm, observant, and able to judge each case instead of repeating superstition. A midwife who had attended many births could compare one woman's symptoms with dozens of earlier pregnancies. She could not measure hormones. She could notice patterns. In a Roman household concerned with heirs, property, and family continuity, her judgment could carry enormous weight. Here's the strange modern contrast. Reliable hormone-based pregnancy tests did not appear until the 20th century, and home tests only became widely available in the late 1970s. More than 3,000 years earlier, Egyptian healers had already guessed that urine contained information about pregnancy. They simply could not read it precisely. Across Egypt, Greece, and Rome, women did not discover pregnancy through one perfect sign. They climbed a ladder of evidence. A missed cycle, nausea, breast changes, fatigue, body growth, and finally fetal movement. Physicians added written theories. Midwives added experience. Women added the most important evidence: their own bodies. The larger lesson is that medical history is not only the story of famous men writing books, it is also the story of women observing, remembering, comparing, and surviving, even when their knowledge was rarely recorded under their own names. So the next time 2 lines appear on a modern test in minutes, remember the woman in ancient Egypt waiting for barley to grow. Different tools, same question.